Every year, millions of patients face misdiagnoses, delayed treatments, or unnecessary hospital visits. But AI is changing this, and hospitals and research institutions are starting to hire AI trainers who can ensure these systems work safely and effectively. It's analyzing data, predicting outcomes, and guiding care faster and smarter than ever before. And the value of AI in healthcare goes beyond automation. This technology can profoundly shape the industry, amplifying human expertise, improving outcomes, and transforming care delivery at scale. It's also growing at an unprecedented pace. According to a study published by the National Library of Medicine, 71% of hospitals implemented predictive analytics in 2024, up from 66% the year before. And the number of doctors using AI, that has shot up by 78% since 2023. From diagnostic imaging to predictive analytics, machines are becoming indispensable tools for doctors, nurses, and researchers. But AI doesn't just learn on its own. It needs guidance, context, and careful calibration. And that's where healthcare AI trainers come in. What's more, they're in demand. Thinking that you want to build a career training AI to save lives? Your time to shine may well be now. Healthcare AI trainers are doing exactly that. In this position, you combine medical knowledge, data expertise, and an understanding of machine learning. The goal is to shape tools that could transform the way care is delivered. So if you love medicine, tech, and problem solving, this might just be your dream career. AI can now flag early signs of disease, recommend treatment patterns, and even help predict hospital resource needs. However, someone has to teach these machines to do it safely and effectively. That's where you would step in if you choose to join the unsung heroes behind AI that actually works for patients. Think of an AI system trained to spot diabetic retinopathy in eye scans. The technology is powerful, but without curated high-quality training data and human guidance, it could miss subtle indicators or misclassify images. Or picture an AI tool designed to optimize hospital staffing. If the model isn't fed accurate patient flow and staff availability data, it could make decisions that disrupt care instead of improving it. Healthcare AI trainers ensure these systems are accurate, ethical, and practical in real-world settings. But what does the job really entail? At the core, it's about teaching AI to make sense of complex clinical data. You'll curate and label datasets, check for errors, identify bias, and design workflows. It's all part of your effort to help AI models understand patient context. Clinicians will also collaborate with you, making sure the AI aligns with real-world practice. So what would a typical day be like? No 2 days would ever be quite the same. Most days, you might start by reviewing datasets from the previous day's AI training sessions. Did the model correctly identify abnormalities in radiology images? Did it miss anything important? That's when human judgment comes in. You refine labels, correct mistakes, and feed improvements back into the system. By mid-morning, you might be meeting with doctors or nurses to discuss edge cases, the rare conditions that AI struggles with. Or you might collaborate to validate your labeling approach. These conversations ensure the AI isn't just statistically accurate, but clinically meaningful. Your efforts might be the difference between the AI making a correct prediction or missing a diagnosis entirely. By afternoon, you could be running tests on the AI system, evaluating performance metrics, or even building new scenarios to challenge the model's reasoning. Maybe you're training it to detect subtle patterns in ECG readings, or teaching it to prioritize patient risk in triage situations. You might engage in a constant cycle of observing, refining, and validating. That's a big part of what makes this role both dynamic and high impact. The skills you need are a mix of clinical insight, data literacy, and analytical thinking. Understanding medical terminology and workflows is crucial, but so is knowing how AI models learn and where they can go wrong. You'll want strong attention to detail, problem-solving mindset, and the ability to communicate clearly across interdisciplinary teams. Essentially, you're the bridge between technology and patient care. Wondering how to break into the field? Education pathways vary. You could start with a background in medicine, nursing, biomedical engineering, or life sciences. Then, gain AI and data training through certifications, boot camps, or specialized courses. Or you could enter from a data science background and build clinical knowledge on the job. Either way, hands-on experience is key. From labeling real datasets to running pilot projects to contributing to clinical AI studies, putting theory into action is critical. And here's where the impact gets exciting. AI in healthcare is already making measurable differences. For example, studies show AI-assisted diagnostics can improve detection rates for certain cancers by over 20%. And hospital AI systems optimizing staffing and workflow have been reported to cut patient wait times by 15 to 30%. Those are tangible outcomes that save lives and resources. As a healthcare AI trainer, you would help make that possible. Looking ahead, the field is only growing. As AI becomes more embedded in hospitals, clinics, and research institutions, demand for skilled trainers is rising. You could start in clinical data curation or model testing, then advance into AI project management or ethics oversight. You could even move into strategic AI implementation roles within large health networks. And with AI increasingly integrated into telehealth, wearable monitoring, and personalized medicine, the possibilities are only expanding. Another exciting frontier, AI ethics and bias mitigation. Healthcare AI trainers are crucial in ensuring models don't perpetuate disparities in patient care. Your helping shape not just the technology, but the fairness, trustworthiness, and safety of the systems that doctors, nurses, and patients rely on. So if you're fascinated by healthcare, energized by data, and inspired by technology that has real-world impact, this career could be your next frontier. It's fast-paced, evolving, and meaningful, and you will be shaping tools that improve lives every day. So how can you begin? Start by building foundational skills in medicine, data handling, and AI workflows. Seek out internships, lab projects, or collaborations with AI research teams. Stay curious, experiment, and don't be afraid to mix clinical insight with technical experimentation. The future of medicine needs people who can teach machines to think like humans while still leveraging AI speed and precision. In short, healthcare AI trainers are the guides, validators, and innovators that make advanced AI systems reliable, ethical, and life-changing. And if you want a career where your work directly impacts patient outcomes, keeps you at the intersection of technology and health, and positions you for growth in one of the fastest evolving industries, this is it. Will you be the one shaping AI that saves lives tomorrow? Keep following us here to explore more emerging roles shaped by technology.